Hi, my name is Kareen. I'm with Kareen and Company. That's K-A-R-R-E-N. Today we're going to talk about facial cupping for cosmetic purposes. So I have a little bit of oil here. What I'm going to do is put it on my client's face. And then I have a number of different cups that I'm going to use. What we're going to do is suction in, release, suction in, release, suction in, release. The whole purpose with the different shapes and sizes is to pull in chi, move blood, push out stagnation, open the channels for healing and for lifting and tightening the facial muscles. And then in the end, what we're going to do is I'm just going to probably finish off with a little bit of gua sha on the neck. And again, thank you. This is Kareen. We're going to do cupping facial. And you can purchase these cups. Some of them are just silicone. These are a little bit higher quality. And they have glass on them. So again, thank you for watching. This is Kareen. Please like and subscribe. Hi, this is Kareen with Kareen and Company. That's K-A-R-R-E-N. Today we're going to do facial cupping, and then I'm also going to show you a little bit of gua sha, because what I want to do is I really want to open up this area. This is the rin. These first 3 points here off the sternum are the kidney points, and I really want to open them up to the lung. I want to take it down from the ear, down the neck, open for my lymphatic drainage, and I'm going to do that first. So we're going to get started. I've already pre-oiled the face, and if at any point I feel it's not moist enough, I'm going to go ahead and put a little more oil on. So this is my little spoon that I use. Here's my sternum, and then here's my first rib, my second rib, my third rib. So what I want to do is I just really want to come here and give a little bit of free flow. You can see a little petechiae. I want to come up on my rin channel. Just helps with just opening the yin or the rin. And it also helps with rebellious chi. She doesn't have rebellious chi, but what we want to do is just open this all up. I'm not going very hard. I'm really not pulling too hard at all. And then I'm going to start from here, and I'm just going to slightly go down her whole neck on that SCM, or the sternal-mastoid muscle here. I really want to make sure that I have some good free flow here. I'm going to take it down under her jawbone, and I'm just going to work it maybe 10 times. I like everything 10 times. For the video's sake, I might just be doing 3. But you're getting an idea. And then I'm going to come up next to the ear, and I'm going to go all different directions, because I want, if we have any tightness, any TMJ, any issues with, grinding the teeth at night, I want to get this flow going before I start all my cupping. And you just come down and out. You're in no hurry to do this. This is the clavicle here. So when you get here, you can come around the clavicle and pretty much flow to the armpit. It wouldn't hurt if you put a little more energy into it and cleared all this out, and then you work the neck and you cleared some of this off the supraspinatus or the trapezius as well. So let's just make sure we're even. And I'm going to come back over here. For the sake of making this video maybe not too long, like I said, I'm going to do 1 to 2 repetitions, but you'll have an idea. There is actually no right or wrong way. I like to gua sha up the neck. I like to gua sha down the neck. I like to get in the front and the back. If you feel you're really tight here, work the areas you feel are tight. You don't want to work it so much that you create a lot of disharmony. The whole point is just to get a little bit of petechiae or pinkness to show healing. Then what I'm going to do with a larger cup is I'm just going to lightly lift her neck. I'm going to start here, and I'm just going to suck up and release. What I'm doing is just getting some movement. So you would do this the whole way, and then I would take it through the first rib, which is a spirit point for kidney 27, and then I'd go through the second rib, which is kidney 26, and then I'd go through the third rib, which is kidney 25, and then I do a little bit on her shoulder here just to get some movement of that lymphatic. If they have any type of issues that hurt, spend a little more time there. From this clavicle to the acromion process here, there's this little divot here. I like to go right here and do a little bit of suction. That's lung 1 and lung 2 in Chinese medicine. So again, we're just going to take it down her neck. I'm going to use my opposite hand. It may not be as easy, but I'm going to grab a suction. 1, 2, 3, let go. 1, 2, 3, let go. 1, 2, 3. If it doesn't grab a good suction, then go right back over it. And you can hear kind of like this little suction just holding. So you basically want to take your cup and take it the whole way down. Take it the whole way down, and then you can come back under the jaw and just lift under this jaw. They have different size cups, so if you feel this is too big or it's too difficult for you to handle, then you just get a smaller one. It's not that big a deal. Everything is about just moving the chi, pulling up the muscle, pulling up the tissue, and just getting some new, fresh, oxygenated blood in there. So this is a larger cup. Then I'm going to use a little bit smaller cup. And you can take it and slide and glide. What I'm doing is putting it on the skin, but I'm not holding it full pressure. I'm kind of just really, you can just pull it up and suck it up, or you can grab a little section and just lightly glide it. Keep your hand on there, so you don't want it getting stuck and you don't want it causing disharmony for your client. You don't want it, if you're doing this at home, it should feel really nice. And you're going to have to learn to use both hands. And let's say you can't glide it, then just do a little suction. Just pull a little skin in there. If you're not good at gliding, it can take time. So there's different size cups that you can use to achieve this. Okay, so that's a medium. That's a little bit smaller cup. Now I'm going to get a round one, and this is nice on my cheek area. And so I just pinch and lift, pinch and lift, pinch and lift, pinch and lift, pinch and lift. You could, let's say you wanted to leave it on there, you could, but this is not like body cupping. I do not want my client to leave bruised. So all I'm doing is just working the areas. If they have a lot of crow's feet, little lines, go a little bit longer in there, but you can also incorporate your cupping in it. So then if you're on the forehead, we can slide, or you can pinch and hold, pinch and hold. Sometimes on the forehead I do like to slide. You can go both directions. You can go up towards the head, up towards the hairline, or you can take it here and slide it to the side. If you lose suction, just slowly pinch and release, pinch and release, pinch and release. You notice how I've done this side, you see that it's pink, and I haven't done this side and there's no pink. So just by doing this, it's quite amazing. It's going to lift all that tissue, and if you had facial lines here, it's going to pull collagen up into that area. So then you might want to know, how do I work around the eyes and how do I work around the lips? Well, we have this really small cup. Go ahead and close your eyes a minute. And you just lift and pinch, lift and pinch, lift and pinch. If you have a large amount of oil on the face, you could slide and glide. But again, it's just a miniature version of what you just witnessed. So listen to it just kind of lightly. So it's like this little kissing sound, kissing motion. And this is really great if you have visual acuity, or your eyes are tired, or they burn, or they tear. This is going to put a lot of nice new blood in the area, and that helps with healing. So we could do that around both sides. And if you're doing it yourself, you're not going to close your eyes. And it shouldn't hurt. Does this hurt at all?
No.
Is it scary?
No.
Okay. Is it comfortable?
Yeah, it feels kind of good.
Yeah, it really is. It's really soothing, and it really helps you feel relaxed. If you get a full facial of this with, you know, the full skincare treatment, this treatment is like a 50-minute treatment, and you don't, every piece of your body is suctioned. So then in here, this is a good area to do for allergies. Right there is Li20. That's a good point to just wake up or help drain the sinuses. And you see how red that is already? So that's really opening up and help with any type of drainage. If you have blackness under your eyes or puffiness, you really want to work this area, not meaning hard, but you want to dedicate a few more minutes to it, and you want to take it down the ear, and then you really want to, you know, slide and glide it out. And as you lose the suction, you just repinch it, but this is just sliding and gliding. I lost the suction, so now I do it to there. Again, both sides. So that is your cupping facial. So now we're working the eyes again. I have another little cup. I actually have two tiny little glass cups. As I said, you can purchase these. I think they're silicone. This is a little higher quality just because I use it in my office. I always think the eyes are really important to really move the chi and blood in this area. We have so many large points through acupuncture that I really like to stimulate. And again, this is good points for draining, and again down here for draining. So then when we do the lips, what I like to do is just lightly go around the whole circumference. I'm sure you've seen some of the kids, they use these cups to make their lips puffier and poutier. You can do that, but I don't do that. But you definitely could practice that at home, girls. What I want to do is if people have a lot of facial lines, I really want to move this. This is a slide and glide. I want to move that chi. I want to make sure that's plump in here and we don't have a lot of excess skin that isn't filled with chi and looking nice. So again, just kind of remember to always take it up. You can also take it up. You definitely never want to drag and slide and create pain. Pull the skin, tear the skin. It always has to be delicate. And then when you're finished, what you want to do if you have oil on your face, this is when you could apply a mask.